Hello once again and a very warm welcome to Moorgate. Now in this video I want to talk about the differences between penis enlargement surgery and penis filler. And we've made a lot of videos over the years, but of them all this is the one that's been long in the waiting, shall we say, one we should have made a long time ago. Because if I get asked one question at least 10 times every day, it's whether you should go for penis enlargement surgery or penis filler. Some guys, they don't know which one to go for, you know, they're stuck in the middle. So I hope this video is going to give you some idea of both options. Really, there is no wrong option. There isn't a wrong option. It's just about finding the one that suits you best. So in terms of penis enlargement surgery, this is just what it is. It's a minor surgical procedure. It's performed under general anesthetic. And this procedure really gives lasting results. And most guys go for penis enlargement surgery because they want results that last, and because they definitely made their mind up that they want their penis made longer in the flaccid length. So with penis enlargement surgery, by dividing the suspensory ligaments, we can increase the flaccid penis length somewhere between 1 and 2 inches. It's not the same to the millimeter for every guy, but the results of this maneuver are very predictable. Once we've done that, we use surrounding tissues to act as a barrier to prevent ligament reattachment. At the time we are doing this video, we are the only practice that can do this. Others will use a silicone implant to prevent ligament reattachment, which is fine, but obviously the implant comes with associated risks of infection and displacement. And in the last 3 years that we've been doing our so-called interposition technique, we've not had a single case of ligament reattachment in all that time. So you get the permanence of the lengthening, but without the risks of the implant. When we've done that, we then go on to take some fat from your belly and your inner thighs. This fat is then purified, and then the pure fat cells are injected into the penis to the maximum it can take. And this will thicken the penis, depending on the initial absorption, somewhere between 1 to 2 inches. So all this takes about 1 hour. It's done under general anesthetic, and depending on the type of work you do, you may need 2 to 3 days to 1 week off work. So in comparison to penis filler, penis enlargement surgery is going to be a slightly longer recovery period. You can't have sex or go gym, sporting activities for up to 6 weeks. It takes some time because the penis goes through a process of change. About 30 to 50% of the fat will absorb in the first 6 weeks, and you'll see the final result after 6 weeks. When, as I say, at that time, your penis then should be 1 to 2 inches longer in the flaccid length, 1 to 2 inches thicker in the flaccid and the erect girth. The big advantage of penis enlargement surgery, of course, is that the results are considered permanent. Most certainly the lengthening cannot be repeated in the future. As you get a bit older, if you want a second fat transfer to top the fat up, of course you can do that. But the results are certainly long term, and this is one of the main reasons that guys choose penis enlargement surgery. So, penis filler. Penis filler is a completely different option. This really is a girth enhancing procedure that's done with the injection of hyaluronic acid. And the type of hyaluronic acid that we use for the penis is the one that's usually injected in the cheeks to create more volume. If you've lost a bit of weight you're looking a little bit gaunt in your cheeks, you can plump out the cheeks with hyaluronic acid. This filler works perfectly well in the penis. The advantage of filler, perhaps over surgery, is that the filler is done under local anesthetic, and it's an in and out procedure. You're able to go home afterwards, no time off work, and a faster recovery period because you're back to sexual activity, gym, sport and so on after 1 week instead of 6 with the surgery. If there is a downside of the filler, of course, is the fact that it is temporary. Depending on the type of filler you choose, it will last between 12 and 24 months, when at that time you will need a top-up treatment, a so-called top-up treatment, to bring the results back to where they were when you first had the treatment. Some guys don't like the idea of this. When they go for the surgery, it's because they don't see the value in coming back every 12 to 24 months and spending more money. They like the permanence of the surgery, the once only event. And of course, with the surgery, your penis then will be the biggest it can possibly be. But that's not to say you can't get good results with penis filler, because you can. Lots of guys ask me, with penis filler, will it make the penis longer? Well, penis filler is not really a lengthening treatment. It's about increasing the penis girth. However, your penis can look a little bit longer purely because of the weight of the filler on the penis pulls it down a little bit. If you look at the before and after pictures on our patient gallery, you know, some of the patients who've had filler look like they've had a penis lengthening, but they haven't. It's just because the weight of the filler can make it look a little bit longer. So they are the fundamental differences between penis enlargement surgery, penis filler. One other thing I should mention is that some guys come to to clinics to see the urologist, and in some cases they don't have enough body fat for a fat transfer. We take the fat from the belly and the inner thighs, but some guys are too lean and they don't have enough. And in those cases, it's possible to do the lengthening surgery and do the girth enhancement with penis filler. That's another option too. Well, I hope that has given you some idea of the key differences between penis enlargement surgery and penis filler. If you'd like to discuss what might be the best option for you, do give us a call here at Moorgate. We're always happy to have a chat with you and discuss the different options and perhaps arrange a consultation with one of our urology specialists. Well, that's all from me today. I hope to see you back here soon at Moorgate with one of our new videos. Until then, bye for now.